Welcome to the Therapeutic Food Solutions podcast. I'm your host, Marian Mitchell. I'm an integrative nutrition health coach, therapeutic diet expert, and founder of The Road to Living Whole. There are many different diets out there. It's hard to know which one is right for you with your chronic illness and autoimmune disease. In this podcast, I'm going to share with you the foundational pieces every single therapeutic diet out there shares, and also how to use the best one for your particular diagnosis. If you've been looking for a meal planning partner, help navigating the complicated healthcare system, and want to feel better quickly, I'm your girl. Grab your kombucha and notebook. Let's dive in. Hey everyone, welcome back to the podcast. I am so excited for today's guest. We're going to have a great conversation. It's Dr. Matt Bernstein, and he is a psychiatrist that has, moved past the allopathic model and into true mental wellness. And his passion is amazing. He's helping a lot of people, and I'm just so excited to learn from him with you in today's interview. Matt, thank you so much for joining me.
Thanks for having me. Happy to be here.
Tell us your story. How did you go from allopathic psychiatry to functional wellness?
Yeah, good question. I was always interested in trying to get the best functional outcomes for my patients, not just reducing symptoms. And those are kind of different in that, in medication research, they really are focusing on how are we going to reduce the symptoms of depression or reduce the symptoms of bipolar. But that doesn't always coincide with really getting back to living a full life, which is really much more important to people.
Right.
Getting back to work or relationships or living independently, whatever it may be. And I was always pretty disappointed about the treatments not really getting us all the way there, but didn't really know what to do about it. And also just the side effects of some of these medications, which can cause metabolic disruptions and weight gain and sometimes neurological symptoms, other side effects that people are really concerned about, and I was concerned about. And then fast forward about 7 years ago, two of my sons got sick with pandas or PANS, which I know you did a
Hmm.
recent episode about, so your
Right.
listeners know what that is. And we just got no help from allopathic medicine, and eventually, found functional and environmental medicine providers that really did help. And I learned a lot during that phase because I was studying all these treatments, and it really opened my mind that, allopathic medicine definitely does not have all the answers, especially when it comes to the brain.
Yeah.
And then, I heard a grand rounds at McLean Hospital given by a colleague, Chris Palmer, who has a book called Brain Energy. And his presentation was about ketogenic diets and their power in not just epilepsy, but other brain disorders like schizophrenia and bipolar disorder, even showing cases where treatment-resistant schizophrenia, people who had been ill for decades on the strongest medications, still having symptoms, had their whole situation completely reversed by a ketogenic diet. And
That's incredible.
it blew my mind. Yeah. And I think, probably a lot of people in the audience didn't quite believe what he was saying,
Hmm.
because it is pretty mind-blowing from a allopathic medicine perspective that we have these strong medications, they're not working, and then, food is going to fix that. So I think most people probably didn't believe it all the way. I definitely believed it. I had already had my mind blown, and I knew Chris Palmer was a straight shooter and wasn't going to be telling us tales. So, it really got me excited, and I started applying this in my practice. Um, at first just working on metabolic health in more sort of subtle ways, but then really realizing that the big gun in metabolic health for the brain is the ketogenic diet.
Do you know the mechanism behind that? Because I think I do, but I would love to hear from you what you think the mechanism is, where the ketogenic diet is so beneficial for nervous system and nervous system disorders, the brain, right?
Yeah, there's actually a ton of research about this because we've known that ketogenic diets have, worked in epilepsy. They actually treat drug-resistant epilepsy, and we've known that for decades. So the neuroscientists have been studying these diets and how they work in the brain. So there's a lot I could say, but essentially, one thing it's important to know is that brain health disorders, mental health disorders are really metabolic disorders of the brain. Metabolism is
I would
important
love to
factor.
dive into that
Yeah,
deeper,
sure.
because as I was telling you, I'm reading this book called Dark Calories, and she went into the PUFAs and
Right.
metabolic, and so I love that I have an expert here who can really take
Yeah,
us on a deep dive with that.
sure. So yeah, I mean, PUFAs are important. They have a lot to do with oxidative stress and inflammation, which we know are big parts of any brain disorder, including all the mental health disorders. Ketogenic diets are very anti-inflammatory. They're also very good at quelling oxidative stress. But what we also know is that these mental health disorders and metabolic disorders, there's this bidirectional association. So if you have a metabolic disorder like obesity or type 2 diabetes, you're 2 or 3 times more likely to have a psychiatric diagnosis, major depression. Same goes the other way around. If you've got major depression, you're 2 or 3 times more likely to go on and develop obesity or diabetes. These are the
Hmm.
same processes going on in the brain. The mitochondria aren't making energy efficiently in the brain for many reasons. I can go into some details on the mechanisms. So, for example, there's this idea of insulin resistance.
Hmm.
So, people are eating high carbohydrate foods, sometimes 5, 6 times a day. Insulin is high all day long and even into the night, and it never gives the system a chance to rest. And what
Hmm.
happens then is that the cells become resistant to that insulin signal, and they're not pulling the glucose into the cells efficiently from the same amount of insulin. But high glucose in the bloodstream is dangerous. So the pancreas makes more and more insulin, and then the cells get even more and more resistant. And then the pancreas has to make even more insulin, and they get more resistant. Eventually, that process leads to prediabetes and diabetes. But
Hmm.
we know in the brain that the brain becomes insulin resistant, and therefore there's a lot of glucose, energy, but it can't get into the cells because the
Hmm.
insulin signal isn't being received. It's almost like this blockade. And ketones bypass that blockade because they don't need insulin to get into the neurons or the brain
Hmm.
cells to be burned for fuel. So we bypass this sort of energy blockade. So that's a really important mechanism.
Hmm.
And then the other big one that I would say is mitochondrial health. So mitochondria are, people may remember, are these energy factories. That's sort of the term people use in each cell. There's hundreds or if not thousands of them in each cell. They're making energy, but they become tired, old, non-functional. They need to be recycled and they need to be renewed, and then we need to make more of them.
Hmm.
Well, ketones are this wonderful signal that tells the mitochondria to recycle, take the old ones, recycle them, and make healthy new ones, and just to create new ones de novo, or out of the blue. And so
Hmm.
that's a really important mechanism as well, is that signaling from the ketones to the mitochondria to make more and healthier mitochondria.
It's really nice to know because, there's what labeling dementia related diseases, type 3 diabetes, that you
Right,
don't even have to be type 2 to start having damage to the brain and the brain tissue and the
right.
brain cells. So it's really nice to know that there's a mechanism to nourish the brain and the cells without, in spite of a poor diet that we were having, that we're now obviously mitigating
Right.
with that. The health coach in me kind of wants to talk about dirty keto
Yeah,
and the
sure.
junk food based keto. I think that that's kind of important to address because as keto has become popular in recent years, we've gotten a slew of ultra processed keto foods.
Yes, I think that's really important to talk about because there are different ways to do a ketogenic diet. All ketogenic means is that we're eating in such a way, really regarding the macronutrients,
Hmm.
that it's forcing our body to burn fat for fuel and to make ketones. And that's all what ketogenic diet means. So that would mean a, higher fat, moderate protein, very low carbohydrate diet. But within that macronutrient ratio, you can kind of do anything, and you can eat
Right.
a really healthy version, or you can eat what you're describing, sort of dirty keto, which was originally popular sort of in the 1970s and 80s when Dr. Atkins had his book, and then there were all these companies coming out with these Atkins desserts. And so the idea was you could just eat sort of, fatty meat and bacon all day and eat these keto desserts at night, and you could be in ketosis and lose weight. And people did lose weight, but that's not a very healthy diet for the brain and for the body. Because we really don't want all these ultra processed food ingredients. They're really disruptive to our gut microbiome. They cause all kinds of problems with inflammation and oxidative stress. And so,
Yeah, we're just not getting, it's not just about fats and macronutrients. We need
we
micronutrients
also
too.
need our micronutrients, right?
Yeah.
So, yeah, I mean, there's this other idea of sort of the well-formulated ketogenic diet, which, has the right macronutrients, but also has a variety of plant material for the fiber and phytonutrients, and
Mhm.
has healthy fats, which we can go into,
Yeah.
avoiding, especially these processed polyunsaturated fats, which are very inflammatory, and healthy proteins. Now, some people want to know, can I do a vegetarian version of keto? Absolutely, you can. I even know someone who does a vegan keto diet, but that's very, very hard to do.
Yeah.
And requires a lot of care and often like a lot of smoothies, I think,
Yeah.
to figure that one out. It's a puzzle. But if people are able to eat animal products, there's an omnivore ketogenic diet with
Mhm.
healthy animal proteins and healthy fats, from both animal and plant sources, monounsaturated fats and saturated fats from healthy sources.
I'm sorry to
Yeah,
interrupt. I want to talk about saturated fat
yeah,
because even today I had a consult right before a meeting, and this guy's really into fitness, and he's like, well, what about saturated fat? And I'm like, you don't have to worry about that. And he was just like, I think like my credibility like went out the window for him because, everybody's taught that saturated fat is going to raise your cholesterol and it's so bad for you. So can we talk about that real quick?
absolutely. Yeah, yeah. I mean, there's been this association in our minds based on some not very good research many decades ago about saturated fats causing heart disease. That's really been debunked.
Yeah.
If anyone really wants to see some good research on this, there's a wonderful book called The Big Fat Surprise by Nina Teicholz, and she really goes through all of the history of how this happened and all the research. And she's posting all the time about and writing articles about the current research. And even the American Heart Association has come out and said there's not a link between saturated fat and heart disease.
Well, even the
um,
USDA backtracked in 2015 on it. It was
right.
very quiet, but they completely removed that saturated fat causes heart disease or high
Yeah.
cholesterol or anything.
But they still say only get a certain amount of fat from
Right.
saturated fat, so it's a little bit of a double message, right?
Right. Absolutely. That's what makes nutrition so confusing.
Right. There's all kinds of mixed messages and confusing, contradictory messages out there. And people think they know, but really, part of the problem is that people cite research that is not very good research as
Right.
the reason why people should do things. There's lots of epidemiologic research, which really is only there to show us associations. It really can't give us causation or definitive proof. We really
Mhm.
need to have randomized controlled trials to get more proof. And there's not that many of those in nutrition. But the ones that there are
Yeah.
really have exonerated saturated fat and the connection with heart disease.
Yeah, I can think about Dr. Terry Walls. She does, the ketogenic diet in MS.
Right.
She has done some gold standard research there. It's been real. I mean, she's what, in her 90s now? Like, and she's still like, she's training up all these scientists to like really study this. And she did launch, great studies on probiotics and probiotic strains and all of that. And yeah, like she's consistently, her research consistently shows, different high fat diets, Mediterranean, keto, all that are beneficial.
Yeah. Yeah, and I think you can combine them too. So I mean, you can do a Mediterranean style ketogenic diet that really emphasizes, olive oil and avocados and some seafood. So really getting your fat sources from these more Mediterranean style products. Or, you can do one that's a little more animal heavy if that's, of interest, or and some people really do well with animal fats and animal proteins. And so it really can be tailored to someone's individual taste. Some people really emphasize dairy in a ketogenic diet, but some people don't tolerate dairy, and you can easily do
Right.
a dairy-free ketogenic diet. It's mostly gluten-free anyway, so it's
Right.
really easy to be gluten-free in a ketogenic
I
diet.
did want to ask you about that because one of the things that I learned, so on my dad's side, schizophrenia is pretty common.
Mm.
And so I kind of dove into research on this like years ago. And what they found was that if they removed gluten from a schizophrenic ward, 100%, they had 100% remission. And then when they reintroduced it, they had 100% relapse.
It's not quite 100%, but there are definitely a subset of people with schizophrenia who have, an issue with gluten, whether it
Mhm.
be true celiac or just a gluten
Sensitivity.
sensitivity, that it can make a big difference in their schizophrenia. It's unfortunately not close to 100%. I wish it was that
Yeah.
simple. Brain is complicated, but that's, certainly for some people who are switching to
Hmm.
a ketogenic diet for their mental health or brain health, getting the gluten out is part of the reason why it works, but not the main reason. I think really, as I said, the main reason are these mechanisms around an additional source of fuel and
Right.
improving mitochondrial health.
Well, and aren't ketones, I guess I've heard that ketones help the cells repair, but it does that by getting the mitochondria working. Okay.
Yeah, exactly. So yeah, mitochondria do so much. They make energy, but of course, if you're making enough energy, the cell can perform its function the way it's supposed to,
Hmm.
including things like repairing itself. Cells are supposed to go through this process of repair called autophagy, and they won't do that if there's not enough energy in the system, or if they're sort of a, sick or dying cell. So getting the mitochondria working better.
Yeah,
Yeah.
that's a buzzword right now. Can you talk about that process a little bit?
Sure, sure. Yeah, autophagy means self-eating in Greek, autophagy or autophagy. And it's essentially that's what happens. The cell will digest parts of the cell. So, like we were talking before about, a mitochondria that's not functioning, it'll essentially get broken down, and then the parts will be reassembled. So it's really a true recycling process. And that occurs in the organelles of cells, these, parts of cells, but then whole cells and then even whole tissues will remodel themselves if one is doing deep enough autophagy. And some of the ways we induce our body to be more autophagic or to do more of it is ketones are a great way. Exercise really induces autophagy, and then some fasting or time restricted eating can induce additional autophagy as well. Yeah.
Yeah, that's I think I hear it most with intermittent fasting.
Yeah.
And I tend to people tend to do intermittent fasting a lot wrong. And so I tend to shy away from recommending it just because people don't know how to do it right. But yeah, so thank you for expanding on that.
Yeah, and probably, when people are just doing some time restricted eating, like maybe a 16-hour fast every day or something like that, you're not getting that much additional autophagy just from a few extra hours of not eating. You really would need to do a longer fast to get deep
Hmm.
autophagy. So I don't focus on fasting as much. Some people, it can be an additional part if that's helpful, but I think, this healthy, well-formulated ketogenic diet plus exercise will get our cells performing a lot of good autophagy, and then mitophagy, which is sort of this, mitochondria autophagy, basically. Yeah.
Awesome. Thank you for expanding on that. Can you share with us what you've seen in and maybe your process in how you help people that are that are struggling mentally with, disorders or whatever, and getting them to a place where their brain is functioning as it should?
Yeah, yeah, I'd be happy to. So, I've been in practice for more than 20 years. I have a outpatient practice of, people that I've seen, some of them for years. And when I first started doing this, I started working with them first, about this, and
Yeah.
telling them what I learned and what I thought, might help them. And some were interested, some were not. For those who were
Right.
interested, at first, we would just start with some slow changes. Let's first start eliminating sugar. Then maybe we can eliminate processed flour. Maybe if people are feeling better, they're interested to move on. Sometimes I would jump to doing maybe that 16-hour fasting, but what I would do is also add MCT oil, medium chain triglyceride oil in the morning. And,
Hmm.
that's a very ketogenic fat. It essentially gets used immediately and turned into ketones in the liver as long as someone hasn't eaten recently and insulin is low. And so people would, have that MCT oil in the morning after a overnight fast, and they would feel amazing, and they would come
Right.
back to me and say, "Wow, what was that?" And I said, "Well, that's some ketones. Your body was making some ketones. You want to learn more about that." So then we would start talking about the science of ketones and ketogenic diets, and then some people got interested in doing the whole, program essentially.
Hmm.
I've just seen incredible results when people get into ketosis. Psychiatric symptoms often just, improve dramatically, sometimes not dramatically, but steadily over the course of months. We've been able to get people down on their doses of medications. I've had some people be able to taper off of medications that have been on them for years. And not only that, side benefits of having more energy and better focus and concentration and better sleep and less anxiety and all these other things that, go along with being in ketosis instead
Hmm.
of these side effects from medications, which often are the opposite, things like gaining weight and feeling sluggish and brain fog and all these other things.
I love that you brought up that sometimes it's slow and steady. I feel
Yeah,
like in the chronic illness world, people are so tired of feeling bad that when they find something that's supposed to help, they don't give it enough time to
right.
actually for their body to actually be able to do its job.
Yeah,
And like, because you have to heal the damage first before you can really start feeling better,
right.
and so I'm really glad you talked about that because sometimes it takes a really long time. I actually like I help a lot of people that are dealing with like thyroid dysfunction,
Yeah,
and that needle moves very slow.
right.
They get their 3 month blood work and they're like, it only improved by like 0.2. And I'm like, yeah, it takes a while for the needle to move. like,
Right.
so I love that you talk about that.
Yeah, some things with, ketogenic diets, some things go faster, some things go slower, and it's different for different people. So I do tell people for, mental health benefits, sometimes we'll get lucky and in the first couple of weeks they'll get some big benefits, but we really got to give it usually 2 or 3 months to really know. Meanwhile,
Hmm.
though, other things like on their lab work get better very quickly.
Yeah.
So elevated hemoglobin A1Cs go down like rapidly. And, I've
Yeah.
seen people go from pre-diabetes to, hemoglobin A1C of 5 or 5.2 in a month or two. I mean, it's
Yeah.
really quick. Triglycerides also like drop like a stone often. If they're elevated, 180, 200, we'll see them go down to 80 in a month.
Oh, that's incredible.
Yeah. So that stuff, and if someone's, wants to lose some weight, that often can be very quick process as
Mm.
well. But the brain
Yeah.
health benefits take more time. People need to be patient, and it's really important to know if someone's in ketosis. So there are a lot of people out there doing a, air quotes ketogenic diet, but are not actually making ketones.
Hmm.
And if we're doing it in a medical setting for brain health or we're trying to treat a condition, we really need to know if someone's in ketosis. So we have to measure. And usually the gold standard for that is a little pinprick on the finger for a blood
Right.
sample for beta hydroxybutyrate. There are other methods to test, but that's really the most accurate one. And that's the preference if we're doing it in a medical setting.
Okay, so I guess my question is because, again, when keto like kind of exploded on the market a few years ago, there were like pea sticks
Right.
and things like that. How accurate are those?
The urine tests are not very accurate, and they're really not giving us a level that's very a good gradation of how much ketosis.
So
Uh,
is there like, how they have like glucose monitors where you
yeah,
prick your finger? Do they
yeah,
have that for keto?
they
For
do.
keto? They do. Okay.
Yeah, there are great products where you can prick your finger. You can get both a ketone level and a glucose level with the same drop of blood, and essentially that's the most helpful way to do it. There are some breath meters for ketones that are better than the urine, but not quite as accurate as the blood, but a
Okay.
lot easier. So if someone doesn't like pricking their finger, there are some breath meters that are good enough to do the job. I think for
Okay.
most people. Yeah.
That's good to know. In your clinical experience and just what you've known from research and stuff, what conditions would benefit from a ketogenic diet?
So yeah, that's an incredible question because it opens up a big answer. There's a paper that just came out saying, ketogenic diets are basically a transdiagnostic treatment, which means, in plain English, it works for all these different disorders. And
Yeah.
they list, they had charts of all the papers of all the different disorders. And it really ranges from things like schizophrenia, bipolar disorder, schizoaffective disorder, severe major depression, OCD, even eating disorders, binge eating disorder, anorexia nervosa, there's data for ketogenic diets. But then we even go into things like autism, Alzheimer's disease. There's a recent paper that just came out about MS. There's been
Hmm.
some papers about Parkinson's disease. And so it really seems to work on, and autism, I forgot to mention as well.
Yeah.
It really seems to work in almost any, brain dysfunction. We've known about the literature in epilepsy for a long time, but now people are applying it in all these other conditions. There's also data on type 2 diabetes that's very strong about reversing type 2 diabetes. And so, there's a lot of uses here.
Which is really great. So I do have some questions about longevity of it.
Yeah.
So is it some like normally from what I've read and what I've learned, and it could be wrong. I'm not, on the newest science of it, but from what they pretty much like the epilepsy that was medication didn't help. It was like 2 years was like, and then after that they transitioned off of it. So is that something? And then the other thing, just before I forget, was that sometimes it caused the thyroid to become hypothyroid. So I was wondering if we could maybe talk about longevity,
Yeah.
medical uses, and if it does cause other problems that would need to be addressed, but the trade-off.
Right. Sure. Sure. So yeah, just to go into that, what you brought up about epilepsy, it's really interesting. So with kids with epilepsy, they often aren't using ketogenic diets until these kids have failed multiple medications. Usually they're on 3 medications and they've tried a bunch more and they're still having seizures all the time. And the ketogenic diet comes in and really reduces the seizure burden, even though the medications weren't able to do the job. Those kids are then able to taper off of all their medications, have this, great reduction in seizures, sometimes becoming even seizure free.
Hmm.
And then usually they stay on the diet for, as you said, a few years. And then they're often able to taper off of the diet and retain that seizure control, not need to go back on medications, which is incredible. We don't have that in
Yeah.
almost any brain condition where, you can actually, heal the brain with the treatment. Usually you have to
Hmm.
stay on these treatments for life, typically, in a lot of
Right.
conditions, right? So we don't really have that data for adults, and we don't have that kind of data for mental health disorders. So
Okay.
what I tell people is that there's a good chance you're going to be, wanting to stay on this diet long term.
Hmm.
And there are people who have been on ketogenic diets long term for epilepsy and other reasons. And we think that it's, a very safe diet to use long term.
Okay.
So that's really the idea, is that, you're going to keep getting benefits month after month and year after year. And, we may be able to taper you down on your medications. We may even be able to sometimes get you off of your medications, but we're not likely going to recommend to come off of the diet anytime soon.
Okay.
I know someone who has done that with bipolar disorder and had been on ketogenic diet for a couple of years and come off medications and did taper off the diet, and so far has been doing very well. But I think that's an unusual circumstance and not the typical thing so far. This is still pretty new,
Right.
using this in mental health. So we'll learn more over time. And there are a lot of randomized controlled trials going on right now for ketogenic diets in various mental health conditions.
Awesome. That's really, really helpful. One of the things that I found as a health coach, where I'm the boots on the ground helping people implement doing it the correct way, is they have a really hard time, at least in the beginning. I think it's more just the mental of like not having treats
Right.
and feeling really restricted.
Yeah.
And so, in your clinical experience, how do you help people kind of move through that aspect of it?
Yeah, well, I mean, we're lucky. I have this program now where we have a residential component where we have a dietitian, registered dietitian, and a chef on
Oh,
site. And so people are eating delicious food when they come to that program, and there's really no issues there.
yeah.
But you know what the chef is showing us is that you can make almost anything ketogenic and make it taste good.
Mm-hmm.
And so when people are missing certain foods, she'll make a ketogenic version of that food. She's made ketogenic chocolate chip cookies and fudge brownies. She makes these amazing fat bombs that are like candy that people eat, and they're mostly fat. And she uses a lot of allulose to sweeten things,
Mm,
which is a
that's a
great,
good one. Yeah.
yeah, great one for people to know about if they don't already know about allulose. She's made ketogenic pizza for people, so almost anything. So, I think, at first that's really common that people are missing their foods and they want some ketogenic version of those foods. Over time, people, sort of settle into, what they like, and there's less of that trying to sort of mimic non-ketogenic foods, and people are just eating what is healthy and tastes good and sustains them and makes them feel their best.
Yeah, that's been my experience as well. Is like in the beginning, I'm like, okay, well, here's some replacements for these
Right,
things. And then as time goes on, so bipolar also runs on the other side of my family.
right.
And so the diet implication for that with that group, like how do you help them adhere to something like that? Because they have a hard time adhering to even medication,
Right.
right? So they feel better, they get off of it, and then they spiral. How do you notice the diet helps maybe mitigate that, or what have you seen?
Yeah, well, I mean, I think it really depends on where someone is in their, health journey. Are they motivated to get well, to, stop these episodes once and for all?
Hmm.
If they have that kind of motivation and they find a treatment that works, that doesn't have a, side effect profile that they hate, they'll
Hmm.
usually be okay with sustaining that. I think, what we see often is in bipolar, there's two issues. One is the medications themselves make people feel awful sometimes. And so that may
Right.
stabilize their mood and prevent manic episodes and depressive episodes, but they don't feel well, they don't feel themselves. And so that's one reason that people stop the medications. But also, there are some people who just really enjoy, especially in the early part of the illness, they really enjoy feeling hypomanic or manic. It feels very exciting or powerful, and so there's that phase of the illness sometimes in bipolar. It can really
Hmm.
be exacerbated by, using substances as well.
Right.
And if someone's in that phase, they're not necessarily going to be a good candidate for doing this whole dietary intervention. So it's really, more appropriate for people who are ready to really treat their condition and feel better and do something that's going to feel definitive for them to, get back out there and functioning and, getting away from these illness episodes.
I'm glad we talked about that. I mean, at the end of the day, even for chronic illness, you have to want to get better
Yeah,
and to just not identify with the disease anymore and just
right.
identify with being healthy. Um,
Yeah, that's a big struggle in mental
yeah.
health for sure as well. Any chronic illness, people become, it becomes part of their identity having this condition. And then there's a lot of sometimes, when the idea of getting well comes up or people start to feel well, it can feel very scary. One's, losing one's identity, maybe losing connections with various help providers who have been important and instrumental in their lives, more expectations now too. Like before, well, I was sick, so I couldn't go to school or I couldn't work, but now I'm getting better, and now all those other, expectations and pressures come into play. It's challenging, and often, it's helpful to have some psychotherapy or some, therapeutic support to try to help with some of those issues if they're coming up.
I'm really glad we talked about that because I would say that is probably the biggest struggle I see is people losing their identity,
Yeah.
and how to reframe that. So I'm really glad we talked about that. What else do you think people need to know about diet and lifestyle and mental wellness? And, what are you shouting from the rooftops that people need to know?
Yeah. Well, I know, a lot of your focus is on food, which is mine too, but, metabolism can be improved in other ways too. So, exercise is great for metabolism, the right
Hmm.
amount of exercise. And if people aren't exercising, just doing something is important. If they are already exercising, maybe increasing that regimen by days per week or intensity. Sleep is incredibly important for metabolic health. And so circadian rhythm alignment is a big part of what we try to do with people in our program. And then it's incredible how much, stress and out of control stress affects metabolism as well.
Oh, yeah.
So, we put continuous glucose monitors on people. And I had this experience when I was wearing a continuous glucose monitor as well, that stress can raise one's glucose even if you haven't eaten anything for hours and hours. All of a sudden, you're getting a glucose spike. It has nothing to do with food, it's just from stress. And I see this now all the time in the people in the program who are wearing these CGM devices. They'll have a glucose spike and they haven't had any carbohydrates. And so where's that coming from? It's from stress causing cortisol and adrenaline to be released, which essentially then releases a bunch of glucose into the bloodstream. And so having a practice of stress mitigation, some kind of mind body practice, whether it be meditation or yoga or chanting or prayer or gardening or whatever works for someone,
Hmm.
really is, and to do it regularly, make it a practice, is so important as well for metabolic health. And then also, community and relationships and meaning and purpose, and those things also, really help with metabolic health as well.
I love that you talk about that. I think people are always like, how do I fix my metabolism? Right. And yeah, I've found a lot of people in my, a lot of my doctors are putting people on CGMs, and we find the same thing. Like the higher the stress, like they can't even eat like a piece of fruit without their sugar going through the roof, when they're stressed versus days when they're like on the weekends, their blood sugar is much more stable,
Yeah.
which is it's just so fascinating. And it really goes to show that what America is doing currently is just a disaster
Yes.
for health and mental wellness in general.
Yeah, I agree 100%. I mean, I can give some statistics about the metabolic health of the country. 30% of people have fatty liver disease. That used to be only from alcoholism up until about 1980. Now it's 30% of people, and it's almost completely from metabolic problems, ultra processed food, sugar, all the things we're talking about.
Hmm.
We have these measures called metabolic syndrome, and there's, sort of 5 biomarkers of metabolic syndrome. Let me see if I can remember them all. So there's abdominal adiposity, or, increased waist circumference, blood pressure elevations, elevations in triglycerides, low HDL cholesterol, and
Mm.
elevations in blood sugar. So there's those 5 things. You need to have 3 of them, be abnormal to meet criteria for metabolic syndrome. Well, how many, what percent of Americans do you think have all 5 of those normal?
Um, Maybe 1%.
Well, it's not quite that bad, but only 7%. I mean, so if you think about that, true metabolic health is you would have all of those things be in a normal range.
Hmm.
And it's only 7% of Americans have all of those things in a normal range. This is
That's crazy.
This is incredible, right? And we have
Yeah.
more than 11% of people have type 2 diabetes in our country now. That used to be just a few decades ago, a few percent. I mean, it's literally gone from 3 or so percent to 11.5 or almost 12% in just a handful of decades. That is what's going on in our country. And people scratch their head and say, why are we having an autism epidemic? Why are we having an epidemic of anxiety and depression in our young people? The answers are in our food and in our practices of, screens all night and not exercising and, all of it. It's all a package. Our metabolic health is not good, and it's being reflected in our mental health.
Yeah. I think what's empowering, daunting for people, but empowering is the fact that you really do have control.
Yes.
And now we know a tool that works,
Yeah.
and I used to struggle, in my late teens and early 20s, I struggled a lot with anxiety and depression. When I changed my diet, I didn't go keto. I just went clean eating, and then I went paleo.
Yeah.
And just by when I started eating clean, it was like, it was gone. Like I didn't have that
Yeah.
struggle.
And that's incredibly common. I mean, yeah, and people don't, if they have a little anxiety, a little depression, maybe a little attentional problems, wondering if they have ADHD, it's probably not necessary to do a full ketogenic diet. As you said, just clean it up, eat paleo, exercise, get sleep, do a little mindfulness, and you can solve those problems. And we need an army of people like you out there, showing everyone how to do it, because there's a lot of confusing information out there, and it's also, people need support and cheerleading and education, because it's not that easy to do on one's own.
No, changing your habits is really hard.
Yeah,
Like you really have to completely overhaul your baseline of like grocery shopping and meal planning and cooking. And a lot of people don't know how to meal plan. They don't know how to cook. They don't know
absolutely.
how to make food taste good. And also, and I went through this when I first started, getting really healthy. It was like 15 ingredients in 2 hours, and then it still didn't taste good, and then it was like the more I pared it down and the more simple I got, and the more I learned how to use herbs and spices. I mean, you can have three ingredients taste mind-blowingly good, but it's like knowing how to do that is
Yeah,
where people really struggle. And then also that whole mentality, and I deal with this. So I have 4 kids, and everybody's like, oh, let them have ice cream. They're kids, but that mentality goes into adulthood. Oh, I had a rough day. I'm going to go get a piece of cake. And it's like, you're not a dog. I mean, I love sweets as much as anybody, but you're not a dog. You don't reward yourself with food.
right. Yeah, it's a great point. We've turned food, especially, sugary, high fat cakes and cookies, into the ultimate reward. What do people bring to the office when they're trying to, celebrate something, or just, oh, everyone's having a tough time. What are we going to bring? They're going to bring, donuts and cookies and cake. And, it is a big problem, because, food is not the ultimate reward, and then
Mhm.
we've somehow oriented ourselves that way, and then combine that with this idea that people, and of course, people can be healthy at different sizes, but
Mhm.
this idea of healthy at any size can go too far, because obesity is a risk factor for serious illness and leads to early death.
Yeah.
And so we have to be careful. I mean, and of course, I also want to make the distinction that there are people, again, who are overweight or obese, or who are metabolically healthy, but
Yeah.
there are also people who are thin and look, from the outside, that they don't have a metabolic health problem, but have a terrible metabolic health problem. They have, an awful fatty liver, and they're pre-diabetic, and that you can't tell from looking at someone. If that's the case, you need to do blood work.
Yeah.
And so I think we equate these things in our minds, and I think people get confused, and but we shouldn't shy away from the fact that metabolic health is incredibly important. It's the foundation of all of our health, including our mental health.
Yeah, I'm so grateful for your willingness to come on the podcast and to talk about all of this. This has been a wonderful conversation. If somebody wanted to connect with you and your program, where would they find you?
So the program is called Accord, and we have a website, accordmh.com. So that's a great place to go. We have, information about the program, but also just lots of resources on there about all the things that I've been talking about, including, a nice blog with great recipes from our chef. And I have a lecture that I just gave on the blog about all these things if people want to hear more about the science. And then if people want to connect with me individually, I have a LinkedIn account that I do look at. That's the only social media that I really work with. Just I'm not big into social media, but I do have a LinkedIn account, and maybe we can put those links
Yeah.
on your site. Yeah,
Yeah, I'll definitely put them in the show notes. That way people can reach out to you.
yeah,
Thank you again for coming on. And, I would love to have you back and take people deeper because there's only so much you can do the first time when you're introducing a topic. But I love diving into the science and the nitty gritty.
yeah.
So I would love to have you back.
I'd love to come back. This was a great conversation, and great to be introduced to your audience. Thank you.
Thank you.
Thank you so much for hanging out with me today. If you found this episode helpful, would you do me a favor and help others find it by leaving a review, sharing a screenshot on social media, or sharing the link with a friend? By you sharing what you've learned, others are able to find this podcast and join our community. Be sure to check out my website, www.roadtolivingwhole.com, for over 160 delicious recipes, a variety of meal plans, and a blog packed full of even more healthy living tips. If you'd like to learn more about how to work with me as your coach, you can schedule a free consult through www.roadtolivingwhole.com/health-coaching/. Until next time, friend. Bye.